religious Jewish men wouldn't see a woman in labour, like they wait behind the curtains and stuff. They don't like see you pushing. Yeah. So like if they have the mums or like a doula or whatever for that bit, they can't then change and have the partner, and then like the partner's meeting them in for the first time once you're home. Like it's weird.
Yeah. Have you had any cases where COVID has like spread to another patient or anything?
We had it where like a lady's test would come back positive, and she was already been in the room with other ladies, so you had to then go around and tell those ladies like, you've been in contact with someone positive, you have to isolate for 14 days. And like they just had these newborn babies and they wanted the family to come and meet them at home and stuff, and now they're told that they've got to isolate.
Yeah.
I don't think we've had it where like someone's caught COVID off someone else, but you wouldn't really know. Like,
yeah,
if you come home and you don't have any symptoms, you won't get a test at home. And like I've been to, and it's crazy because you think if me or you had a cough, like you would just go for a test. The amount of ladies that I go and visit that I don't feel well and they don't go for a test,
yeah,
like they just be at home.
It's just so bad, like putting other people at risk. Yeah. Babies can't get COVID, can they? It's not really.
Yeah, so they can, but they're not. They don't really get very unwell with it. Like we've not had the babies that go to neonatal unit will probably get a test, but very few come back positive, and even if they do, they seem to be fine. Yeah. I think it's different if it's your first or your second or third or fourth, whatever. Yeah, I think so, because I think it's just the hospital environment. Like, if you broke your arm now, whatever, you'd want to, like, get out of it because you can. And also, like, I think for myself now, if I had, like, anything minor, not minor, but if we had our tonsils out now, like, I'd be scared to go into hospital, like...
Yeah. You'd want to push it for afterwards, wouldn't you?
Yeah, literally. So, like, all these people that were having, like, you know, like, elective surgeries were, like, thank God, it's like, they didn't want to go now. Obviously, some do. But yeah, they're more nervous with that, and then I think they're more nervous because they've not got. They might only have one person with them who might not have been the person that they might have wanted someone else.
Yeah.
And then like they get nervous because they can't even see our faces. Like it's probably a bit intimidating.
Yeah.
Like you can obviously be chatty and nice with your voice, but like you can't tell if someone's smiling. You can't like give the midwife a hug and like just like little things.
When they're giving birth, do they have to wear masks?
No. They only have to wear a mask when they're in clinic. So when they like come and they're just pregnant but they're not in labour, and it's like a 20-minute appointment. So it's like going to the GP, so you wear your mask for that. But in labour, no, you don't wear your mask. But in America, like I see people's, like I love YouTube, like Desi, you know Desi Perkins, just like this makeup YouTuber from America. She had a baby, and like you see her vlog in labour, she's pushing with a mask on. Like we don't have that.
You see people in the gym in America wearing masks. I can work out with a mask on.
I'd rather not go to the gym.
Yeah,
I don't want to go to the gym anyway, but the partner will wear a mask the whole time.
Yeah.
Because they've not had a test or anything.
Do you feel more pressure too?
I think at the beginning, yeah, because women would ask questions that you wouldn't know the answers to, that no one did. And like, even my friends were like, oh my God, can I do this? Can I do that? Like thinking I knew a lot because I was the only one that was like still at work. So in that sense, yeah. And I think because of the lack of midwives that there is, it's more pressure because you've got more, like an increased workload. And like you have to do more actual work because there's less people to like share it between. But then I think on the other hand, because they know how hard your job has become, and like you had the whole NHS clapping and people were so appreciative of you, that like they were so much more like thankful for little things, or like they'd understand if you forgot to go and bring them this because at the same time you had to do this and this. And like I just think they were more like understanding of different things. Like I'm not judging them at all because like it's like everyone's doing it. But then for me, I feel like I can't do it, and I like get annoyed at myself that I'm missing out on things that my friends are doing because like I'm young and I'm healthy, and if I did get COVID, like obviously touch wood and you don't know, and I've had my vaccine and things, like I would be okay. And like if obviously my mum got COVID, I would have to stay off work and I'd isolate and like I live with her. But for me it's like the feeling of guiltiness that like if I went to go to my friend's house and then the next day they were like, I'm so sorry, I've got a cough, like I've gotten for a test, you have to isolate. For me to ring in work sick and say like, I'm really sorry, I've been in contact with someone positive, it's like when it first started, I would literally come home I would take my uniform off in the porch. I would literally be in my bra and knickers in the porch, take my uniform myself, put it in the washing machine myself, run straight up without touching anything, go shower straight away. My mum, like, didn't hug me for months. Like, she wouldn't go, like, we'd sit at the table together, but, like, she wouldn't hug me because, like, we didn't understand anything.
Yeah.
And, like, she'd put my clothes in the wash at, like, a really high temperature. And, like, we were anxious. Like, even my friends, like, wouldn't want to go on a walk with me at the beginning because I was, like, this infected one. Like, everyone else was at home. Like, I was the only person that was going to work, of, like, all my family, all my cousins, all my friends. And, like, I was, like, this, like, infected person that people wouldn't want to go on a walk with. And I could get it. Yeah, that made, like, me and the whole family more anxious. And then, like, when I was working on delivery suite at the start of it as well, like, you had to go to work in your own clothes. You had, like, a laundry bag that you'd put your uniform in and you'd take it home, so you didn't have to touch your dirty uniform. Like, you'd put the bag in the wash and wash it in there. I think it was, like, the fear of the unknown. Like, at first people were like, oh my God, you can catch COVID from touching the same door handle. Like, all of these things that people used to be saying, which still probably are true, but, like, do you know what I mean?
Yeah.
I think it's when you didn't understand. It was more the anxiety of bringing it home.
Yeah.
That was bad. And everyone was the same, and, like, people had young kids, and people, like, at the beginning, like, I was like, oh my God, my mum's got asthma, like, if I give her COVID, is she going to die? So my parents are divorced, so, like, at the beginning, so I live at home, like, I didn't have to choose, I'd live with my mum. But, like, I didn't see my dad for, like, 3 months, or, like, 4 months. Like, I just would FaceTime him because, and, like, I was also scared that, like, if I caught it from my dad and then I rang in sick, they'd be like, oh, why are you going to someone else's house?
Yeah.
Like, so that was bad.
It is a lot of, like, overthinking, isn't it?
Yeah. And, like, thinking about, oh my God, if I go on a walk with this person and that and all these kind of things. So it was more about the anxiety of giving it to someone else, I think. And even that, it was scary. Like, at the beginning, I would, like, now I go into COVID positive patients' houses all the time. Like, I've probably been to 2 last week, and, like, I really don't even think about it anymore. Like, I really do. I come out of the houses, and obviously, like, I sanitize my hands and whatever, but, like, I don't really think, oh my God, because I've just used to it, and, like, it's been a year and I've managed to go a year without catching it. But at the beginning, if I was to go with a COVID positive patient for 2 weeks, I would be literally waiting for symptoms to start.
Yeah.
Like, you're waiting every day, like, oh my God, have I got COVID today? Have I got COVID today? Like, I sneeze and I've got COVID. And it was just like the anxiety of waiting to catch COVID. And I've just not, but a lot of people have. We had a lady who, on Christmas Day, like, she gave birth to the baby, like, weeks early because she was so unwell from COVID. The baby was born, and the next day they had to put her in an induced coma because the COVID was so bad. And then she was in a coma for 2.5 months since Christmas Day, and she's only woken up, like, last week. So, like, for her, she has just woken up now, never met her baby for, like, 2.5 months. The baby's not even got a name. This baby's at home with the dad, who have not been able to visit her.
It's crazy.
And I've never ever met her baby, and now, like, her mental health is going to be horrendous. Like imagine like me to live for the first time. You could literally get given a strange baby and you wouldn't know it's yours.
Yeah.
Like, it's crazy. I've had loads of ladies, like, loads, who will ring up and say, like, I'm sorry, I can't come to my appointment today. But then it's like these stories, like that lady Grace and, like, this lady in our hospital that was in a coma. And, like, we have a lady now, like, another lady who's, like, in intensive care, who, like, is really struggling to breathe and is on oxygen, and she's, like, in a really early pregnancy. So, like, the midwives will have to go to see her on, like, the ICU ward. And, like, you do hear of, like, young people getting really unwell. I think it's been a year now, and I've just, I've worn my mask every day for a year, that it feels normal. I genuinely cannot remember how I used to do it. Like, so weird. Like, it's just second nature. Like, I just put my mask on, put my gloves on, I put my pinny on, and it's just normal. Like, you just become so used to it that I can't remember life without it, which is a bit sad, really. But, like, I go to work, I forget about everything. In the first wave, like, my mum was probably at home scrubbing her shopping, like, all these things that was going on, and, like, we were doing all these random things, and, she was only going to get deliveries from the supermarket. She wouldn't go in, and, like, I'm just going to work as normal. Like, you just get so used to it. Like, everything for me just carried on as complete normal. The only difference is when I came home, I didn't go see my friends.
Yeah.
Like, it is just completely normal, and it's, like, cringy, but it just happens. It's like one is born every minute, so like it's just the same. I used to be literally in a woman's space, like as close as you can imagine, like literally right close, and I used to breathe on each other like it was just so normal.
It seems weird now, doesn't it?
Yeah, it seems weird. Like obviously you wear gloves for like intimate things, like, you know, obviously delivering a baby I've always worn gloves for. But I didn't used to wear gloves to take somebody's blood pressure. Like you just touch the skin. Like I would touch your hand and not think about it. But now, like I won't even do someone's blood pressure without gloves, or, you know, I used to like pass, you know, someone said, can you pass me my baby? I just take the baby out of the cot and pass it to her, like wouldn't think about it. And now I'm like, oh yeah, let me just put a pair of gloves on. And like it's so sad when you think about it, but it's just so normal. No, it's been a year. I think the stress of it all and the anxiety is less. Like I definitely don't feel like I did in that first lockdown. Like I used to be like scrubbing myself when I came home and like stripping off in the porch. Like I don't do that anymore. We used to like have a system where we'd like put a table outside, like a trestle table. We'd have like the clean and dirty. My mum would literally like spray Dettol on that because we didn't know what was going on. Yeah. Make me wear gloves to open my parcel, or like leave the parcel in the porch for a few days before I was allowed to open it.
Yeah.
But meanwhile, I'm in the wards with a woman right in my face. You know what I mean? It's obviously negative, but it does kind of feel a bit positive. I don't know, just how like everyone's come together so much as a team, and like the clapping on a Thursday. I know like we don't do it anymore, and it was a bit cringe, and maybe it wasn't necessary, but like I used to like get emotional like on that first time. I was like crying like it was crazy, only because it was like the only person that was going to work, like the only one. Like I had like a pass in my car that like if the police pulled me over and said, why are you driving, like I'd say I was going to work. And like it did feel really appreciated. Like now I think the appreciation is so much bigger, that like there's just such a bigger picture, that like people don't feel annoyed when they've got to wait 2 hours for the prescription because people are literally dying. It was like a treat that we got like free parking for 3 months, and like we'd get emails saying all of these things like, thank you for your hard work, here's free parking or whatever. And that they would say, if anybody needs help, this is like our we have that occupational health who like you go to if you've like hurt your back, you need to take time off work. And they do offer mental health things, but probably they were working from home, I would have thought, and you would get a phone call. And like people who like wanted to go off work for mental health, like if your mental health's so bad and you feel like you can't work, you would be made to feel
like it's wrong to do that. Yeah,
and like you feel guilty because people
they don't understand it if you're not going through it yourself. So.
Yeah. So there probably was support that was offered, but I don't know anyone that would have gone for it, because
it should have been more, I guess.
And like, I can't imagine asking for a day off to go for that. Do you know what I mean? But you probably could. Yeah, that sounds negative. There probably was help. I think because everyone was kind of feeling the same, and obviously everyone feels, some people have it worse than others. I don't know people that really went for the support because they just thought it was normal. You know, it's just, you are going to be anxious when people are dying around you. Yeah. But the things that we would do before COVID is like we all booked to go to like Bongo's Bingo, just say like we can't do that. No one would organise anything for us. No. The all we got was like free parking. We didn't get anything else from work. And like we don't get like a pay rise or any extra, nothing like that. Or like all the free stuff that we got was from outside companies sending stuff in, like local people. No, they didn't, because there was nothing we could do, because we were all supposed to, like, we all social distance from each other, so there was nothing. And like they can't do it in working hours because you've got to work.
Yeah.
And out of working hours, you're all at home anyway, so what is that to do? We have like team meetings once a month where we'll all meet.